Hello everyone, my name is Nico Bioma. I am here today to talk about erectile dysfunction or dysfunction. Whether it's called erectile dysfunction or dysfunction or impotence or impotency, they are the same. Don't allow yourself to be confused with the terminologies. They are all the same. Erectile dysfunction is inability for a man to obtain erection and sustain it for sexual intercourse. What do I mean by that? A lot of men today have erection, but it will not be sustained very well for them to have sex. Meaning, some have erection, but it will not last. Time for action, they can perform. Another way you can understand what I mean is that it is a situation where a man cannot get and keep erection firm enough for sexual intercourse. That means some will have erection, some will not have. But some of them that have the erection, it cannot last till the time they want to start having sex. And this has destroyed so many homes. So many family today has broken because of this problem. So many wives today have left their homes because they cannot manage anymore. Even some of those men are really complaining, but they don't know the causes. But today, if you watch this video till the end, you will know the causes of erectile dysfunction. Impotent. It is quite unfortunate that people are abandoning their loved ones because of this problem. But I would like to inform you that over 70% of men above 40 years are having this problem. And one of the major causes of this problem is our lifestyle. Yes, our lifestyles. Some people consume excessive alcohol every day. A lot of people smoke different kinds of things you cannot mention here. Lack of exercise is also another factor. But we are not going to discuss those ones. Let us discuss the important ones. All of them are important, but the ones you will know there is problem. Let me not waste your time and go straight to the point. One of the factors that causes erectile dysfunction or dysfunction today is hypertension. A man that has high blood pressure called hypertension most times don't have erection, or at times have erection but it will not last. During that period of having sex, the erection will come down. The person will lose the erection. And this makes their wives or partners to feel so bad, including the man. The man will not feel okay. Yes, he might pretend as if he's feeling fine, but it's not. How the high blood pressure affected is this. The hypertension affects or hardened and narrowed the arteries that carries the blood, which we call atherosclerosis. In that situation where it's hardened and narrowed, the movement of the blood will become difficult. So it limits blood circulation during that period. And when the blood could not get to the organ sufficient, the organ will malfunction. Meaning that because of insufficient blood circulation to the organ, because it has been narrowed, it is hardened, erectile dysfunction or dysfunction will occur. Another factor that causes this dysfunction or dysfunction is diabetes. If a man has diabetes, particularly type 2 diabetes, and he has started treating it, most of the times the blood sugar level will go very high. It will come to the level that at times is going to weaken all his arteries, his cells, even the tissue. In that case, the blood or the arteries, the vessels that are supposed to take the blood to the organ for it to have erection will drop. Erectile dysfunction has occurred in that case. Another factor that also causes this erectile dysfunction, I am calling dysfunction and dysfunction depending on where you are. I know outside Africa some people call dysfunction, but here most people call dysfunction. So don't misquote me on what I know why I'm using the two words simultaneously. Stroke is another factor. Stroke is a cerebrovascular accident of the brain, where some of those cells in the brain will die and blood circulation will stop or reduced, and it will become difficult for those cells to rejuvenate the way they're supposed to rejuvenate. In that case, it's going to affect the nervous system of the person. It's going to affect the supply of the blood even to the organ. It's going to affect proper blood circulation to the whole body. Erectile dysfunction or dysfunction will occur. Heart disease is another issue. Cardiovascular problem, a situation where the heart that pumps the blood is having issue to pump blood to the other organs of the body. The blood will not get to the organ, the penis, at that point in time. Even if it supplies, but it's a limited blood now that it supplies. In that case, you won't have good erection. Even if you had that erection, it will not be sustained for you to have sex at the required time for action. You can perform. Another serious factor is people that have epilepsy. Epilepsy is another big factor that if you have epilepsy, it comes once in a while. It will make sure that it destroys your cells. That blood supply will not be there too. Another factor is spinal cord problem. Yes, spinal cord. When you have spinal cord problems, you can't have erection. If you're a man watching this video at this minute, check anytime you have even ordinary waist pain. During that period, erection will become difficult. you cannot achieve or obtain good erection during that period. So people that are having spinal cord issue are expected to have erectile dysfunction or dysfunction during that period. But after treatment, it will be restored back. Blood will begin to flow again. Diseases, infections also is a major problem for erectile dysfunction. When the organ also sustain injury, if the organ has problem, has injury, the erectile dysfunction will be there. You won't achieve a good erection during that period. Stress, anxiety, depression, these are factors that causes erectile dysfunction or dysfunction. Impotence is not a sad news or a surprise news for you to hear that even some pastors' wives are being taken by other men because of this major problem of erectile dysfunction. Yes, I'm going to also, in another video, I'm going to talk opposite of that, where women are having their own case that aggravate pain during sexual intercourse, that even makes their men also to feel bad. I'm going to talk about that, but today we are talking about men, erectile dysfunction or dysfunction. So medications, there are some medications that you will take, some drugs you will take that will destroy your cells. That is why most times we say self-medication is very wrong. Yes, also, there are also medicines that can be prescribed by even a professional, but have after effect of this. Smoking is bad. I want to advise you that is watching this video. If you notice this and you have treated yourself and discovered you are free from this, just try, take 3-5 days and take good water, morning, afternoon, night, for 3-5 days, and see the miracle in natural medicine, and see how you are going to restore your home and start enjoying your lovely home again. A lot of women today are complaining of such problems. Even some men, a lot of men also complain. I don't know, maybe women believed that it affects them most. No. It also affects such men. They might be pretending as if all is well, but inside them, they are dying. If you are opportune to watch this video, I will appeal to you to share to your loved ones so that they will be able to know or see and know the remedy of how to handle such situation. Thank you, and God bless you. Thank you.